Welcome back to the podcast, everybody. Today we got a special guest. He is the inaugural DAP Award winner at Breslin Public Health, a full-time employee at Berkeley Media Studies Group, and a master's in public health student at Johns Hopkins University. Y'all clap it up for Charles Udeze.
Thank you, brother. I really appreciate being here. I'm really happy to be on this pod with you, and I'm looking forward to our conversation.
Yes, sir. Very happy to have you here. Very honored to be in your presence, Mister. All right, but we got this Burna Boy song playing as your intro song. Gotta love Burna Boy. He's one of the hottest hottest artists out here right now. Is there a reason why you picked up the song in particular to start off the episode? Is it your favorite?
Yeah, I mean, besides the fact that it slaps, the song is almost completely in Yoruba. Yoruba is a language from Nigeria. I'm not Yoruba myself. I'm Igbo, but when I look at the translation, I was like, oh, this is a hype song, right? Basically, Konibaje means it won't spoil, and in the song he keeps repeating Ina imotitan, which means that my light will shine, and so he's basically saying a prayer to himself, right? Where like hey, my light will keep going, and that's something we got to be, especially as brothers, we got to like keep that in the back of our minds as we're doing whatever we're doing, right? Perseverance is really key here, so I felt like that was fitting for the occasion.
Absolutely, man. We gotta persevere, man. Public health work is frontline work, man, but we gotta keep persevering, man. Fight never stops. I like that choice right there. All right, but Charles, could you tell us a little bit more about yourself as far as like how you got into public health? Because I know a lot of people have. There's just a variety of different journeys out there of how people get into public health. Like some people know right away out of high school. Some people didn't even know it was until college. So where do you fit in that spectrum? How is your journey? When you first got started, like how did you get into public health?
For sure, yeah. I like I mentioned, I'm from Nigeria. I was born in Nigeria, and I came to the States when I was really young. My middle name is Chukwu Kadibe, which means God is greater than a doctor. My mom named me that because when she was pregnant with me, she survived a serious car accident. She still has some of the disfigurement on her leg from what occurred, and I was born premature, and I was still healthy when I came out, and so she was astonished. Right, we're talking about late '90s Nigeria. I'm from a small to mid-sized village, and she couldn't believe that her and her son both survived everything and still made it out. And so this name, God is greater than a doctor, to be frank, really never sat right with me in the beginning. It felt like, in a way, it's like, Mom, you're dissing the doctors? Like, the doctors saved us. But as I have grown, especially, I moved to the States. I started off in Hayward, California, which is out in the East Bay of California, and eventually moved to what I consider my hometown, Stockton, which is in the Central Valley. Everywhere that I've gone, whether it's in Nigeria, East Bay, Central Valley, this notion that there are places in this world where healthcare are not accessible to every person, to the point that if you want to be healthy, it requires divine intervention. I found that everywhere, right? And so this name that my mom gives me, Chukwu Kadibe, resonates not just for me, but for all the people out there who don't have access to care, don't have access to the things that help us live happy, healthy lives. And it's shown me that that's what I want to guide myself towards. How do I, as Charles, go out into this world and make the world better so that everybody has what they need to live happy, healthy lives? And so, when I was coming up, the immediate pathway to getting into anything health related is, go out there, become a doctor. And so I remember when I was applying to school, I went to University of California, Merced for undergrad. We're doing orientation. This is before the first day. And they were the various schools at UC Merced, all the various majors were doing presentations on what they do, what they teach. And I came in as a bio major. So here I am, I'm sitting in orientation. My parents are there next to me. And before the bio presentation comes up, there's this major up there about public health. And my idea about public health at that time wasn't the clearest. I had one introduction to it during a pre-health conference at UC Davis, which is another school here in California, up near Sac in Davis, California, where there was a Harvard professor who was talking about, he's a professor at the T.H. Chan School of public health, and he was basically saying, hey, public health is not that fun. The tone I'm using is the way he was pronouncing it. He was like, the tone isn't really that fun out there. You don't really get paid for it. It's not necessarily medicine. You're not working on the disease itself. You're trying to prevent it. It's really important work, but it's hard to stay motivated. And he's saying that straight up in his presentation. So when I had seen it when I was applying to school, I was like, I'm not doing this. But when I saw this presentation during orientation, they were talking about all the various pathways, the various things that you can do with public health that can help you improve people's lives, right? I'm talking about healthcare access, right? And initially, I was very interested in expanding healthcare insurance. At that time, I didn't really know about universal healthcare. I didn't know about single payer healthcare. All I knew was I wanted everybody to have health insurance so that they can go to the hospital and get what they need to live a happy, healthy life. And I wanted to be a part of expanding that for everybody. And so they were mentioned that was one of the functions of public health, right? Health economics, it has this key component of it where you're trying to help everybody get care in the American healthcare system, which is very much guided by private health insurance. But there are also these other components of public health, right? They were talking about social determinants and how the built environment impacts health, and that having this multidisciplinary education will prepare you for all these different facets, whether it is you want to go down a medicine route, or you want to be an epidemiologist, or you want to work in health policy, which is essentially what I do now. That all of these different functions of public health all impact a person's ability to receive care, all impact a person's ability to access the resources that help them be healthy. And as a public health professional, you can go out and you can work on it all. And me being who I am, I was like, I got to work on it. I got to do this. And so orientation, I got that presentation. As soon as the presentation was over, I go to the nearest counselor and I'm like, hey, I want to switch my major. And they were like, oh, what do we do? We've never had this happen before. But it was the right decision. They sidelined me for like 2 hours that day, like tried to switch my major up. But I haven't looked back. Public health is where I want to be. I believe that public health is in everything that we do, whether you're working on communicable disease intervention, you're working at a health department, you're doing health policy work, or you're an organizer, you're a teacher, you're a grocery store worker. All of these impact a person's health outcomes. All of it is part of public health. And when you see that, you understand that all of this is important. How do we make sure that it's all cohesive and oriented towards the goal of making everybody healthy? So yeah.
Wow, man, it's like you were literally born to be public health, man. That's an awesome story, man. I feel like that's always been something I've been thinking about in the back of my mind ever since I started college, man. Like, I feel that's when I really started getting into public health. I got some exposure in high school, but just to seeing how interconnected it is to everything is really, and how it's able to change like entire populations of people's lives. Like literally everyone is connected to it in some way. I think that's the beauty of it, man. It's such a beautiful field to be a part of, man. And just my hat's off to you, man. That's awesome. So Charles, like a lot of public health people, man, you be doing a lot, man. You're working, you're in school, man. I feel like a lot of people, everyone on this podcast gotta have their Superman cape on just to get through the day, man. Cause y'all be out here doing a lot.
Yeah.
And who can blame you? It's front lines of works, man. If you're not doing it, who else is gonna do it, man? There's a lot of people out here. That's why we need the brothers out here. We're trying to recruit more because we need more brothers out here. But just for the sake of just like, I don't know, we still gotta give you your flowers though. Let's give you your flowers right now and just really understand what you do when it comes to how you are finding your way in the public health. Like, how could you guys give us a breakdown on like what you kind of do on a daily basis for your grad program or your career? Just what are you doing right now and where do you want to take it?
For sure. Yeah. So, right now I'm a student at Johns Hopkins University. I go to Bloomberg School of Public Health. I'm completing my MPH. At this point, I've already done all the coursework. And so I mentioned earlier me being part-time. I'm working on my capstone. At the end of the program, you have to do a capstone presentation where you get really deep into a health policy topic for me. get really deep into a health policy topic and you provide recommendations or your findings on what your topic is. And so I'm writing up my report right now. That's given me a lot of leeway to focus on my other master's program, which right now I'm doing a Master's of Science also in Data Analysis and Policy at Hopkins. It's in their advanced academic programs program there. And I'm taking that one real slow. Part of the reason why I'm going through this gauntlet with school is before I applied, when I was at UC Merced, actually, I was working in health education. I was a campus peer health educator. And so that gave me the opportunity to learn about the different mental health factors, physical health factors, sexual health, and chronic disease, things that affect the student's ability to go to school and achieve academically, right? And there, I had one of my mentors, who was one of the upperclassmen at the time, ended up going to Hopkins, going to the Bloomberg School for her MPH. I really respected her. She's very smart. She works in health policy now, actually, in Sacramento. And so when I was thinking about doing my MPH myself, I reached out to her and I was like, hey, how was the school for you? How'd you get in? Like, it's Johns Hopkins carries some weight. How'd you get in? Like, how'd you like the school? And she mentioned, like, for her, she wanted to make sure that she was doing everything intentionally, right? She ended up going the part-time route because it allowed her to work. It allowed her to stay home. And so for someone like us who, without a full scholarship to pay for school, you'll be taking on either, crazy debt or, trying to scramble to find ways to pay for school as you go. This gives you a little bit more leeway. Obviously, it's a bit slower, but at least you're able to, take as many classes as you'd like to in a term. And if you take as much as you can afford. She ended up doing that pathway, and that's what I ended up doing myself. I decided to move to Baltimore because I had spent so much time in Stockton. I wanted a chance to explore something new, and so I moved to the complete opposite side of the country. And so during that time, I was able to work in DC on health policy work while doing essentially a health policy MPH. And so it was kind of crazy being able to learn about writing an issue brief in my course, and then go out in my job and be presenting issue briefs to politicians, right? Mm-hmm. I worked at the National Association of County and City Health Officials, which is a national nonprofit that advocates on behalf of local health departments. They advocate on behalf of 3,300 local health departments nationwide. We hear about what's going on at the local health department level. How are your programs going? Are you getting support? And then they try to be the intermediary between the local health departments and the federal government. So a lot of that funding for the federal government, we're trying to advocate for so that we can get that money down to the local health department so that they can do the work for the community members that they serve. I got to do that for a couple of years. Unfortunately, with the change in the administration, I ended up having to switch jobs, and I was fortunate to land at Berkeley Media Studies Group, which Berkeley Media Studies Group is it's a nonprofit, a narrative and communications nonprofit operating out of the Bay Area. But doing work nationwide that focuses on helping advocates and organizers talk about the issues that are important to them, right? Public health, like I mentioned earlier, is in everything that we do. And much of the public health gains that we benefit from now, right, come from these organized movements that have helped bring in new policies, new programs, new resources into communities that allow them to be healthy. These public health movements, these movements that have brought in the public health gains aren't necessarily public health movements. They're really what you would consider their own kind of issue-based movements, like, for example, the labor movement. The labor movements in the 18th and the 19th and 20th century helped give us the 40-hour work week. They helped give us weekends, right? These are things we take for granted now, but that was won through blood, right? People formed unions and they were challenging their employers to give them better working conditions. And if you look at the history of these movements, the employers were not far from kind, right? They ended up killing some of the union organizers. They would threaten them, they would intimidate them. But the horrors of this ended up winning us a 40-hour work week and weekends, right? And these are times that we can rest. We can actually sleep at night, right? We can actually look forward to a weekend where we can have time for ourselves, right? And now the labor movement is pushing for a four-day work week, right? Because of productivity's increased. But these are the kinds of things that you don't typically think of as public health, but have profound impacts on our health outcomes. And so art should be considered as such. Those are the kinds of movements that Berkeley Media Studies Group tries to build communications around. We try to help organizers understand how to talk about their issues, who to target their communications at, and how best to get their talking points out in the media, because the media informs a lot of what we think is possible. When we're able to do that, we're able to pass policy that expands healthcare for all, right? We're able to bring grocery stores to communities instead of liquor stores. We're able to pass policies and programs that address equity, right? Are anti-racist, that are able to bring in diverse representation to fields like public health, right? A lot of organizers think, though, that, and I have an organizing background myself, I do abolition organizing. A lot of organizers think that if you just say the right thing, that's going to, move a policymaker to action. But if it were that easy, then organizers wouldn't have a job. A lot of what we understand is that people are motivated by different things, right? They're motivated by what they value. And so in order to push somebody to action, you have to understand what motivates them. BMSG has a bunch of resources that we offer for free for people who want to pass policies and programs in food access and housing and education and healthcare access, so that they're able to understand what their audience needs to motivate them to action, and they're able to articulate that succinctly in a way that's newsworthy and a way that ultimately brings about their intended goal.
Is there like a favorite or least favorite aspect of what you're doing right now as someone working and balancing student responsibilities?
Yeah, my favorite part about it is the flexibility. I've moved across the country. I've come back home and I'm still in school, like I've had to adjust my course units. I've had to take time off. I've had to do all those things, right? And Hopkins has been very accommodating of that, because many of my classmates are like me, people who have had some experience working in public health before. Maybe they're out working, they've been a doctor, they were working at a health department, maybe they're an organizer, and they wanted to advance their career, they wanted to advance their education, they wanted to learn new skills, and so they go and they pursue a degree at Hopkins. That flexibility is really key. I've met a lot of great people who lead organizations. If I got the opportunity to network with them and, again, adjust my units, I've been able to work full time and do fellowships, do internships, do research while still in school because of that flexibility. And so, I always advocate, like, anybody that's looking at, doing their MPH, look at how the curriculum is structured. Look at the mission. Look at what do you want to think about, what you want to get out of your program, and look for the programs that are able to give that to you. You are paying for school. This is a service that you are paying for. You deserve to be in a program that serves your needs. And so it takes that time doing the research, understanding what the school offers, talking to the other students who have gone there, and them telling you about their experiences for you to help you make the right decision. I would say the least favorite aspect of it is that it is rigorous, right? Like I mentioned, the courses at Hopkins, the curriculum, each course is condensed into 8 weeks. So these are classes that at other schools, they might give you the full semester to go through, right? And they might break up the concepts, break up the lectures over a wider period. When you do a course, you understand that it's going to be accelerated. It's manageable. It takes some time to get used to, but once you get into the rhythm, it's certainly manageable. It's just a learning curve, but it was definitely something that early on I was like, oh man, this is how it is. But yeah, once you learn it, it gets good.
Yeah, man. I think that's awesome, man. The fact that you're out there representing John Hopkins, that's awesome, man. Like, and that's just a nice setup, man. Being able to work full time and be in the program, even though like it's a difficult program, man. Like you're built for that, man. The fact that you said you're already like wrapping up, just working on the thesis kind of project now. I think a lot of people have imposter syndrome, man. It's all about just getting past that first wave of resistance, man. You gotta like you said, just kind of getting into the rhythm of things. That learning curve is gonna go away once you get into the rhythm of things. It's all about just getting past that first adversity, man. But that's awesome, man. Is there something specific you want to do with your master's in public health degree once you get out? As far as
Yeah, it feels weird. It feels weird talking about it, but realistically, after the master's, like I do think I'm going for a doctorate. I do think that that's not technically a job, so I'm not giving you a real answer where after college, but the I, and what is still to be determined. That's what I'm learning about, but I want to keep my options open for that. Whatever it is I do, what you will be hearing from me is I'll be talking about these linkages between organizing and health, right? That
yeah,
organizing is so important. It really is necessary for what we are going through right now. We need to be connecting with our neighbors. We need to be talking about what a better life in not just in this country, but in global health context and across the world. We need to be talking about what is needed, and we need to be fighting for that.
yeah,
Again, the largest public health gains we've received were won through organized movements, right? Our ancestors really did set up a world for us that is better than the ones that they came from, and we have to carry that condition forward. And so everywhere I'll go, whatever it is I'm doing, I'm going to be talking about organizing as a key concept that all of us need to be taking up. Whether you're working in medicine, whether you're working in public health, whether you're again a teacher, whatever it is, like find a way to get organized. Join an organization, talk with your neighbors, understand what their needs are, and try your best to make your own spark on this. You're not going to be able to do everything, but with other people, you'll be able to achieve.
absolutely, man. That's why it's called public health, man. You can't do it.
Exactly.
It's not solo health. It's not person health, man. It's gonna take the whole community, man. That's what it's all about. It's all about. And what you're saying is true, man. Like organizational stuff. I think that's what public health is. That's like a key component of what public health is, man. Like it's all about getting all these components of public health, like you're saying, how diverse it is, getting us all on the same page for the betterment of the entire population, man. That's absolutely what it's all about, and I'm happy to see, and I'm excited to see just all the great things you continue to do, man. That's awesome. This is like the Brothers in Public Health podcast, obviously, but as we know, in America and just and globally in the public health realm, men of color specifically are generally underrepresented in public health fields. And as someone going through the fire right now, in the classroom, in the workspace, how has being a man of color in public health shaped your experience thus far?
Yeah. The biggest reason why I ever even considered health as a career pathway was because of obviously what happened with me, but also what happened with my father, right? My dad is the hardest working person that I know. He living in Stockton. Stockton is a commuter town. It's at the northern tip of the Central Valley. The Central Valley is the breadbasket of the United States. A lot of the fruits and vegetables that we enjoy in the United States come from the Central Valley. It's farmed here. It goes up through Stockton. Stockton's a transportation hub. It's got an inland port. It's got an airport. It's got two highways going through it. And so, the agriculture goes up into Stockton and out to the world. But outside of that, there isn't much industry, right? There isn't much employment opportunities, which make it so that residents here oftentimes have to go work in the Bay. I work in the Bay, right? But have to work in the Bay to try to make their ends meet, right? And so my dad did that for 30 years, right? He was working in Fremont. He made the commute from Stockton to Fremont every day diligently. He rarely missed a day. And that took a toll on his health, right? To the point that he was having heart attacks every other year. And so a seminal moment in my life was seeing him, the hardest working man that I know, a man that only shows like two emotions, stoicism and anger. At the end of his surgery, I walk into the room and I see my dad at peace, right? He's recovering. He's just there comatose, right? He's intubated. He's comatose, and I'm coming up on the side of the bed. I'm like, wow, to know that again, this is the hardest working man I know. The only way he can find peace is, at the end of a surgery, a serious heart surgery. That's the only time he can find peace. I was like, this is unfair. How many other people in the world have to go through this where the only time that they're able to find that peace, especially as men who are trying to oftentimes provide for their families, who are really deeply ingrained in this narrative of individualism that America has inculcated in us, they're carrying a lot on their shoulders, and the only way that they can find peace is, they have to go to be drugged up in the hospital. That's the only time you can find peace. That can't be the case. And so, carrying that forward in public health is, understanding that we have to get out of that individualism mindset. We have to get out of that narrative, and that's hard to do because it's put out in the media. Social media has, men of color who are succeeding, and they're telling us that, oh, they did it all by themselves, they worked hard, which it could be the case, right? But instances like seeing my dad go through what he was going through is knowing that a lot of times in the United States, even if you do put in all the hard work, the fruits of that labor are not always realized, right?
Yeah.
And so this idea of individualism being something that anybody can achieve, the American dream being something that anybody can achieve if they just pick themselves up by the bootstraps, is something that we have to get out of. And I found that through organizing, that's one of the best ways for us to get out of that mindset. Being able to work alongside others, especially others who are not like you. And so in public health, I've had the fortune of, although it's something that I know that, we wanted to change at Brothers in Public Health. We want to have more brothers in public health. But I've had the fortune of working alongside a lot of women and femmes, right, who have been phenomenal mentors to me, honestly. And, I think about my time at the local health department and being able to be mentored by people at the local health department who do this work daily. That helped me understand what I wanted to do, right? And even now at BMSG, right, I think I'm the only guy on the team, and I learned so much every day from the women I work with. When I was at NACHO, same thing. Being able to do that, be receptive to their experiences, be critiqued, has helped me become not just a better public health professional, but a better man. And so that's something that I think as men who are trying to get out of this individualism narrative, like being able to be receptive to that and hear when you might fall into those traps, being able to be pulled back and say like, hey, reoriented on the right path, that's been really key. And so, yeah, I think that that's a mark of a man, being able to receive critique, receive feedback, and act accordingly, make right decisions. That's really key.
Man, but as far as your public health journey, has there been like a moment or an aspect of it that has been the most fulfilling to you so far?
The most fulfilling parts of my work, whether I was working at the local health department, whether it comes from my organizing, the community development work, the abolition work, whether it's my work here at BMSG or when I was at NACHO, it's always been when I have opportunities to talk with community members. I learned so much about life by hearing what other people's lives look like. I think it's really easy, especially when you start to get the degrees, you start to get the notoriety and all that stuff, to think like, oh, I know exactly what this issue is. I don't need to hear anything else, But I feel like every time I have a conversation with a community member, I'm learning something new. I'm learning about something I hadn't thought about before. I'm learning about a new concept. I'm learning about something, a blind spot of mine. And like, again, that all comes together to make me a more complete person, right?
Yeah.
And so that's the most fulfilling part of public health work. As long as that work is grounded in community, you have the opportunity to improve yourself. You get to learn so much about who you are from working with other people.
Absolutely, man. That's why I like the podcast, man. I like to talk to people, learn from other people, just hear people's experiences, and because you can learn something from everyone, man. Like there's something to be learned from everyone. And I think that's the beauty of public health, man. Just being able to, the fact that's so rooted in people. I couldn't do a job that doesn't have some sort of interaction with people, man. I love that. It's all about staying grounded in community. That's awesome, man. But let's transition to one of my favorite segments of the podcast, which is the public health breakdown. And now I was just wondering if you could explain for the audience and me one public health concept that you find important that you think everyone should know about.
Yeah, I'll say, I mentioned earlier that for most organizers, they feel like if they just say the right thing, it'll change hearts and minds, and that a politician's going to listen to them and do exactly what they say. But like I mentioned, it's more complicated than that. It takes understanding what motivates that person. And so for that to occur, it's important first to know how to do audience segmentation and learn about who you're talking to. But there are also these components of how to develop a message that I think all people can benefit from. What are the best practices in developing an advocacy message? Like I mentioned, it's important to know what motivates your audience. And for a lot of us, we are motivated by what we value. Those values can be things like responsibility, freedom, dignity, money. What else? I've already mentioned responsibility, trust, pride. These are all the things that motivate us to do the things we do and be the people who we are. Once you understand what your audience is motivated by, you have the opportunity to use those values, incorporate them in your message, and create something that resonates with that audience. And so we say, before you know what you want to say, you have to know what you want to do. You have to know what motivates your person. When you're developing your message, lead with that value. If you're talking with a politician who really values fiscal responsibility, like that's their number one thing, you'll craft your message in a way that says, hey, we believe that everybody should be fiscally responsible. Here are the things that are getting in the way of people being fiscally responsible, right? You want to make sure that value is centered in your message so that whoever you're talking to understands that this is for them.
Yeah.
When you go in from that, you start to talk about that problem. You're talking about what's blocking that value. You want to frame the problem that you're trying to address through your policy in the terms of the value that you're talking about. So I mentioned the fiscal responsibility thing. If the problem is that people don't have access to healthy foods, and one way to get that to happen is by increasing SNAP benefits, right, the Supplemental Nutrition Assistance Program, then you might say that we want people to be fiscally responsible. We believe that everybody should be fiscally responsible, but they're unable to do that right now because there isn't enough money in their wallets for them to make a good financial decision, right? That way you talked about the problem and you framed it in the terms of the value. Here's where you can start to talk about your solution. One way to make sure that people have money in their wallets is by giving them the resources that they need to buy healthy foods from the grocery store. We have a policy, the Supplemental Nutrition Assistance Program, which allows residents to be able to get a monthly stipend that allows them to go to the grocery store and buy food, right? So there I've talked about the solution, and I've, again, framed it as a solution to the problem around the value that we've talked about. You keep it short like that, you keep it brief like that. You don't necessarily always need to get into the intricacies of how SNAP is funded or who gets it, because a lot of times that's where people's eyes glaze over. But if you keep it in that kind of framework where you talk about values, you lead with values, you frame your problem in the terms of that value, and then you talk about the solution, then you'll be able to keep somebody's attention and move them closer to action. Of course, that saying the right thing isn't the only thing you need to do. That needs to be paired with action. So you want to make sure that you're organized, you're getting media involved, that you're getting residents involved so that they can maybe pressure your target or maybe do further advocacy. Just saying one thing isn't going to change their minds, but if you're able to do that and work alongside others to help push your target forward, you'll be closer to achieving your policy solution. Yeah, for sure. It's something that requires practice. I always say, it's best to do this in a group setting. If you're able to work alongside other people to develop your messages, other people might have insights on your target and all that, then you'll probably be able to develop a better message. So, and you write down drafts, you give it over to one of your teammates, they critique it, they mark it up and say like, oh, you don't have to get into this. You can get that part out, or maybe add this in. It's not something you have to do alone. It's not something you have to do by yourself. You get better alongside other people. So, again, BMSG, we offer a lot of those kinds of resources for people. You just go to our website. If you ever want to talk to anybody, we have our contact information there, and we'll do that for everybody because we want everybody to be able to achieve justice and equity wherever they are.
Absolutely, man. And the way you broke that down was very smooth, man. I didn't even see that coming. Yo, this pro can snap, man. Y'all gotta get hip to that, man. That was smooth. I like that, Charles. That's tight.
I appreciate it.
All right. All right, let's. We're gonna end off with a little fun segment. It's the rapid fire fun question segment. And then what I'm gonna do is I'm gonna ask a fun question, and then you're gonna answer. And it's gonna be. I'm gonna put you on the spot. I'm gonna ask you a question. You gotta answer it ASAP. And then you think you're ready for this?
I'm scared, but we'll see, bro. We'll see.
All right. Question one. I mean, it's nothing too crazy. It's not like nothing too controversial. You know, I'm not gonna. You're not gonna get fired, kicked out of school, or anything out of this.
We'll see about that.
All right. All right. Question one. If you could pick one superpower to help you out with your public health career, what would you choose and why?
It would be mind reading. It really would.
Mind reading.
Yeah, it's nothing weird, I promise. But like understanding what motivates people. I'm always interested. Yeah, I've been in spaces. I've been on Capitol Hill. I've been talking to Congress people before, and it's you'll go, you give them the fact sheet, you talk about the issue, and you'll see them or a staffer like nodding their head and everything, but you want to know like, are you really listening for real? Like, or what are you really thinking? It'd be nice to read their mind and be like, I think you're thinking about yada yada yada. We have something for that too, and then get that there. So yeah, mind reading will make it really easy.
I know that make that last exercise like just like that, man. If you know what's motivating people, make that argument just like that, man. And you promise it's just for public health work, right?
Yeah, I also, it make it easier to hoop and all that too. But he thinks I'm gonna go left, I'm gonna go right. Hit him with a tween. So yeah, it helps in other ways too.
Yeah, nah, for sure. Question two: if you could become an expert in like any non-public health, I mean, it's hard to say non-public health because we've been talking about how related it is to everything, or how disciplinary it is, but any non-healthcare, like immediate healthcare related field or subject, if you could pick any subject and just like that, you're an expert. What are you picking and why?
It'd be music, and specifically instrumental like music. In high school and college, I played trombone and tuba. And in high school, I also played the double bass, but I wasn't really that good at it. But I continued that throughout college, and once COVID hit, I stopped playing. And so, if I could go and be an expert in that, I'd love to play in a symphony. I'd love to play, trombone in a jazz band. I'd love to play my tuba in a classical symphony at one point. But man, it takes a lot of work. It does. I have a friend who he's doing his doctorate in music now, and he's good. He plays piano. He's really good. And so I'm like, I went to one of his concerts last year. And I was like, man, I wish I could do what he's doing, but he put a lot of work in. He did. So yeah.
Nah, that's a good choice. That's like something. No matter like you, there's no way around just studying that. Like just putting in the hours for that. Like if you're able to just become a savant like that, you're saving yourself a lot of hours and just time practicing, man. That's crazy, man.
For sure.
That's a good choice. That's a good choice. All right. Question number 3. This might be a little controversial depending on like how what your answer is, but if you had the power to just permanently discontinue one food item off the shelves forever in the name of public health, what would you pick and why?
This one's easy, bro. I'll be honest. It's raw milk specifically.
Raw milk?
Yeah, like discontinue that. Like all pasteurized milk is just cooked milk, right? All you did was just warm it up so that the pathogens die, right? And they put it back on the shelf. This whole raw milk nonsense, it's gotta go. And also because the folks that are, my bad, I don't know if I'm talking to a raw milk disciple, but
I don't even know. I'm not even hit like that.
All right, for sure, for sure. Hey, don't do it, kid. Trust me, it's not worth it. The people that drink that advocate for raw milk are like all these influencers that are kind of part of the Make America Healthy Again movement. RFK is the real, I guess, the leader of that movement. And they're anti basically like every single thing. Some of the stuff makes sense, right? I think if they want to talk about food dyes, they want to talk about preservatives, they want to talk about factory farms, all these things. Like, yeah, all that shit, we should definitely work together on that. But instead, they want to focus on the things that we know are scientifically proven to make people healthier, right? Raw milk is not the thing you want to die on. Like, it don't taste no better. You get the pathogens, you get sick from it. And I swear it makes people louder. I swear drinking it and like having all those like the bacteria and everything, it like makes you want to go get a podcast mic and start saying like some real nonsense. So
Yeah.
raw milk got it.
Yo, have you ever tried it before? I've never even tried that. I don't even know where I would get that.
Risk it, man. I'm not gonna risk it. I used to be like, I don't even drink cow's milk anymore. At this point I only drink almond milk. But if I'm drinking cow's milk, I'm gonna do the pasteurized one. I'm gonna do the one I know is safe. So, for anybody watching, I'm sorry if your raw milk disciples gotta go.
Hey, y'all heard that in the audience. Y'all listening, man? Raw milk make you talk loud. Y'all heard it from Charles here first.
Yeah, it makes you a podcast.
Side of public health certified right here. But my last question for the episode and for this rapid fire segment is to put a bow on everything. Like, what is one final message that you want to give, like a young brother out there in the audience, young person out there in the audience, considering just getting involved in public health, like as a career?
Yeah. One thing I would say to a young brother, it would be that mediocrity is expensive. And what I mean by that isn't that you have to be perfect in every single thing that you do. But if you choose to do something, choose to do it with all your heart and use all your effort to see it through, you won't always succeed, but at least you know that you did everything in your power to succeed. I think for us as young people, we're trying out a lot of stuff, right? I think as being a man, being a person in general, but specifically being a man involves making decisions and standing on those decisions, right? And a lot of that involves you using all the information you have at your disposal, all the resources that you have at your disposal at that moment to make the right decision. That won't always happen, right? An adult that's maturing is able to see the outcomes of their decisions and act accordingly. The worst thing that can happen, though, is if you are making that decision and you're like wishy-washy about it, you leave points on the board. You leave opportunities out there, and those opportunities are expensive, right? I'm saying this as somebody that's done it before. If you don't go all in your grad program, you might have to retake a class, right? Those classes you got to pay for, right? Literally financially expensive, right? If you don't do something all in the first time, you have to do it again. You have to pay for it in time, right? If you choose to make a decision that keeps you away from your family and friends, you might cost you some relationships, right? So whatever you're choosing to do, make sure it's something that your heart's in, and you put your heart into it, and you put all your effort into it. That way, whatever the costs are, they'll be worth it in the end.
Absolutely, man. It's all about, I like what you said, it's not about like always being perfect, man, but you gotta be excellent. Like, you gotta truly give it your best, man. Like, your best doesn't have to be perfect, but it has to be, leave no doubt, man. That's what's like, you can't leave no doubt when you're trying something, man. That's gonna make the difference, man. We're not gonna create change with half-hearted efforts, man. It's gonna take our heart, man. We've got to put our heart into this work that we're putting in here. Mm-hmm. I think that's very sound advice for even someone like me, man. Like, just coming up, man. Like, it's very just that theme of excellence, man. You just gotta be excellent in everything you do, man. Like, if you're gonna do it, then really do it. I like that message, yes, sir. But that wraps up my questions. That wraps up the podcast interview. Thank you so much, Charles. It's been an honor and a blessing to have you on the podcast. Just thank you so much for taking the time out your schedule to do this today, man. Thank you.
For sure. And no, thank you for having me, man. I look forward to the next conversation. And I love the work that Brothers in Public Health is doing. I encourage everybody that's listening, if you haven't joined already, join BIPH. The brothers here have been so supportive for my goals, and the mission is something I think we can all get behind, right? We need more Black and brown people in these fields. We need more Black and brown men specifically in these fields, because without it, your voice isn't being considered, and that's leaving our programs, our policies in disarray. We need the guidance of people who are closest to the issue. So if you haven't already join BIPH. It's been a great experience for me.
Yes, sir. Is there anyone, as we wrap up, anything you want to shout?
I don't feel like I'm ready yet to be saying that. Follow me on LinkedIn. I think I'm trying to I'm considering, building on my media profile myself after doing all this work at BMSG. I'm probably going to make those announcements on LinkedIn. Yeah, I'm easy to find. My last name is unique, so I'm usually the first person that shows up. But, I've already talked about BMSG a couple of times. We have all these resources. If you want to be a better communicator, that's a great place to start. Our website is bmsg.org. We have a lot of resources out there for free, a lot of guides and toolkits that I think people can use. And then one more thing, for anybody that's burgeoning in their health equity journey and wants to learn about a lot of what we talked about in this podcast about the linkage between public health and organizing. When I was at NACCHO, we developed an online course series called Roots of Health and Equity. If you go to rootsofhealthandequity.org, it's a 10-course free online series on the basis of health equity and how us as public health should be concerned with building the power of our communities, building the power of our professionals to achieve the health resources that we need. It helps if you want to learn about racism and it's linked to health equity. If you want to learn about capitalism and wealth inequality, and it's linked to health equity. If you want to learn about cis heteronormativity, that is gender inequalities, especially on the basis of sexual orientation, and it's linked to health equity. We have those courses there. We also have a course on building narrative power, which is something we didn't get to in this talk, but it's something that is really key for us, really moving hearts and minds to a better future. So yeah, that website's rootsofhealthandequity.org. It's a resource I still look at. I helped create it. I still look at it from time to time to inform my things. So yeah, everybody should go out and make an account, and it's completely free. So.
But I also just want to shout out Brothers in Public Health too on my behalf. Shout out to them for supporting me and giving me this opportunity to lead this podcast and learn from all the amazing brothers in our network like Charles. If you want to stay updated to all the stuff that Brothers in Public Health is doing, follow them on Instagram, Facebook, LinkedIn, Brothers in Public Health. And if you're out there in the audience listening and you want to become a member or donate or support Brothers in Public Health in any sort of way, check out the website at brosinpublichealth.org to become a member, support, donate, whatever you want to do, whatever you feel comfortable doing. And also just subscribe here on YouTube, Spotify, Apple Podcasts. We're on everywhere out here, man. We're Brothers in Public Health Podcast. Stay tuned for the next episode. Thank you all. Thank you, Charles. And thank you, everyone out there listening. Peace out.